Good morning, everyone. Today I'm here to speak on the topic the relation of screen time and reading with myopia, pre-myopia, ocular biometric, and anthropometric measures in 6 to 7 years old children in Jharkhand. Do you know by 2050 it is predicted that half of the world's population would be myopic, with 1 in 10 being pathologically myopic? It is crucial to prevent myopia and start therapy early to reduce its progression, as myopia is closely linked to visual impairment in mid to late life. More recently, the pandemic control measures, including lockdowns, accelerated the universal adoption of screen-based engagement globally. The aim is to study the relation of screen time and myopia, reading with myopia, pre-myopia, ocular biometric, and anthropometric measures in 6 to 7 years old children visiting Tertiary Eye Care Center of Jharkhand with the objectives to understand the relation between screen time and ocular biometric and screen time and BMI in 6 to 7 years old school children visiting Tertiary Eye Care Center of Jharkhand. It was a hospital-based cross-sectional study held at Department of Ophthalmology at RIO RIMS Ranchi between November 2023 to June 2024, with 52 school children of the age group between 6 to 7 years who visited the OPD were included in the study. The participants' parents completed a standardized eye health and lifestyle questionnaire reporting eye and vision problems. The parents reported their child's daily screen time with one of the following options. This was the questionnaire that we gave to the parents. The children were examined. The examination involved cycloplegic autorefraction performed at least 30 minutes post-installation of anesthetic and cycloplegic eye drops. The Zeiss IOL Master 500 was used to measure the axial length and the corneal radius. The participants' height and weight were also measured, as can be seen in the photographs. The primary analysis used continuous dependent variables like axial length, spherical power, corneal astigmatism, height, weight, and BMI. Result: there were more female population under our study compared to the male. 60% of the population belonged to the urban area. And you can see from this interesting graph and table that 46% people had screen time of 1 to 6, and 33% of them have screen time of more than 2 hours. Urban area had more screen time. Upper socioeconomic status also had more mean screen time compared to the lower socioeconomic status. 1 to 2 hours screen time had mean axial length of 23.84. And as the screen time is increasing, so is the mean axial length. The BMI is increased, and so is the mean axial length. The people who had mean screen time greater than 2 hours had more BMI. And there was more axial length in the female compared to the male. This shows the table regarding child reading and writing. Participant on screen greater than 2 hours per day had 0.12 diopter more astigmatism than those on screens less than 2 hours per day. High myopia has been associated with obesity or overweight. The relation between screen time and increased with the rule refractive astigmatism was found in line with Tong et al. Children on screen over 2 hours were almost 4 times more likely to be overweight, aligning with the literature where 2 or more hours per day on screen in childhood is strongly associated with overweight and obesity. Conclusion: increased screen time was associated with more myopic power, high axial length, higher with the rule astigmatism, and higher BMI. Myopia and astigmatism frequently coexist. Both were significantly associated with increased screen time, so parents should be counseled regarding screen time monitoring of their children. Of further concern, the ubiquitous use of screens may increase sedentary activity and decrease outdoor activity. The World Health Organization advised limiting daily screen time to less than 2 hours for children 5 years of age and older. Clinical implication: myopia increases retinal detachment. Dedicated educational program aiming to reduce screen time are vital to be promoted. Parents should regulate child phone usage. Thank you.
A very nice study, Dr. Vatsala. you are looking at a very small sample size, 52 children of a very narrow age range of 6 to 7 years, am I right?
Yes, sir.
So the generalizability of these findings is going to be slightly limited. Plus, we were also, trying to look at the results. We've again got inferences, and the results are not really there. But definitely, you've pointed out some very interesting things that, you know, which is in line with what we were expecting. But you've provided evidence for that. That even in India, more screen time means more obesity. More screen time, interestingly, means higher axial lengths. Uh, but we would be happier if we had more data to go back to. Thank you
Yes,
so
sir.
much. Anybody has any observations or questions, please? Sir.
It was more of a cross-sectional study, right?
Yes, sir. And
One
that was
time.
the limitation of my study, that the population size was a little
Ah.
lesser.
And the
This
question,
was a thesis that had been given, and it's a thesis which has been presented.
No, sir. I've observed a lot of patients in my OPD coming with the complaint of watering in the eye, like the small children. So I thought of starting this, and
So you can carry on,
yes, sir.
maybe with a bigger sample size
Yes, sir.
or a more expanded inclusion criteria, we could have more meaningful inputs from this.
Yes, sir.
Interesting, definitely. Thank
Thank
you
you,
so
sir.
much.
Thank you,
thank
sir.
you.